Serena Williams has very openly shared the fact that after having her baby, she couldn't breathe. She went to the doctors, they didn't believe her, and eventually she was right. She had a blood clot in the lungs, and that was affecting her breathing. She's not the only one. And what happened to her happens to thousands of women around the world, and it's a leading cause of maternal death. I'm Remi, a doctor in obstetrics and gynecology, a mother of two, and I'm building her health room, a space for women after they've delivered to fully recover physically, mentally, and socially. In today's video, we are going to unpack what it means to have a blood clot in the legs, the lungs, anywhere else, and how you can take steps to make sure that if this is happening to you, that you seek help on time. This video is for educational purposes. I am not your doctor, so I cannot give you personalized medical advice. What I hope is that from watching this video, anything that you learn that concerns you, that you will take it to your own clinician and take steps to improve your health. A blood clot in the venous system can occur at any point in pregnancy. It can occur in the first trimester, throughout the pregnancy, and also after the delivery. After the delivery is the time where this is most likely to occur, especially in the first 6 to 12 weeks. It affects at least 1 in 1,000 women worldwide. And if it's not picked up early and it is a blood clot in a dangerous place, it can unfortunately lead to death. But don't be afraid. There are risk factors, things that you could be aware about yourself to make sure that you seek help early, and there is treatment for this condition. Why does it actually happen after the delivery? You've gone through delivery and there is a risk of bleeding, and the body knows that. And what it wants to do is to prevent you bleeding a lot, right? So I've got a video on heavy bleeding after a delivery. But what it does is it makes your blood stickier, thicker, and that's where you're more likely to develop clots. Watch this video to the end because I will be sharing the symptoms of a blood clot, not only in the legs, not only in the lungs where they commonly happen, but where they could happen in other parts of the body. It's important to know who could be at risk of developing a blood clot. When you go through antenatal care and postnatal care, at least in the UK, there is a risk assessment where they look at your age, your BMI, how many children you've had, if you've ever had a blood clot before, if anyone in your family has had a blood clot, if it's ever been found that you have markers within your blood that make you more at risk of your blood clotting, as well as if you've had high blood pressure, diabetes. After the delivery, have you lost a lot of blood? These are the things that they will be going through to determine if you are at risk of getting a blood clot. If it's found that you are at risk, the best way to prevent a blood clot is to give you blood thinners in order to prevent you getting a clot. And you will take that through the pregnancy, and lots of women will take it after the pregnancy. And that could be for 6 weeks if it's found that the risk is really high, or 10 days if it was felt that it was slightly a lower risk. Now, despite this, you can still get a blood clot. And how does this show up? I said about Serena Williams, in her case, what it's documented is it showed up with breathlessness and chest pain. But she was someone who'd had a blood clot before, so she knew what those symptoms were like for her. And it's really shocking that even in her documentary, that knowing that she'd had a blood clot before, I believe she was about over the age of 35 at the time of her first delivery, she was still not seen to be at risk of it, or it was dismissed. By the end of this video, I will share with you the symptoms that you need to keep in mind, that if you were to experience any of these, that you would seek medical attention quickly. Like I said, a blood clot could be in the lungs, which is where it's very common, or in the legs. And when I'm counselling women for any delivery, there's a risk of blood clots in the legs or the lungs. And that's not always true because you could develop a blood clot elsewhere. So if the blood clot was in the lungs, you would find that there might be breathlessness, especially when you're active. So say you were walking from the top floor in your house down to the bottom and you weren't getting breathless. What you would then find is that actually as you're becoming more active that you are developing breathlessness. And we call that shortness of breath on exertion. So when you're actively doing something, or if you're finding that you're significantly breathless at rest, that could also be an indication that something's not quite right. Alongside this, you might experience chest pain, especially when I'm breathing in, or coughing up blood. And it might be a streak of blood or it might be an actual blood clot. I actually remember a case many years ago of a patient who only just had that one time of coughing up blood, one off, and that was it. And their partner had encouraged them to come to the emergency department. And in the emergency department, this could be a blood clot. Eventually, they had a huge blood clot that required treatment. And actually coming into the hospital that day was life-saving for them. And so if you have any of these symptoms, it's really important that you don't dismiss it. It might be that you're just feeling faint or dizzy, and that could be a case of not getting enough oxygen through to the brain, and it could present like that. If the blood clot were to be in the legs, especially in the lower legs, it might be that you've got pain at the back of a calf, with swelling, with tenderness, and it's not abating, it's just not going away. That could be in one leg, it could be in both legs. It could even be in the upper leg, so in the thighs. It is also possible to develop blood clots there. There's a risk of blood clots in the brain. So women who have headaches in pregnancy, and we do see this clinically, they have a headache, it's not going away, they might have some nausea, some vomiting with it. And yes, it might sound like a migraine, but actually when you then go on to investigate, there are some deep veins within the brain. They're at risk of getting a blood clot there as well. And again, if that's the case, it does require treatment, which I'll go on to discuss later. So you have veins all over the body, and therefore there's risk of blood clots in any of those deep veins. And that could be the ones that are around the bowels, around the ovaries, that travel down the leg. And if you have any non-specific pain that's not getting better, you're getting feverish with it, I would really strongly recommend that you go to hospital, especially if you were to have any of the risk factors I'd mentioned before. And like I'd said, there are ways to prevent having blood clots, and the main way is by engaging with the clinician, having a risk assessment, and having the blood thinners. But the other things that you could do, as well as having that, is being mobile in early pregnancy, being mobile through the pregnancy, and especially in the postnatal period, making sure you're not dehydrated, so drinking lots of water. If you're going to go on a long haul flight, especially more than 4 hours, not that it's particularly recommended, but making sure that you've got compression stockings on to encourage the blood flow back up through the heart and around the body. As well as that, if you are on a plane, making sure that you're walking around and making sure that you're encouraging that blood to sort of travel around the body. And ultimately, it's about seeking help early. I've mentioned the blood thinners where it comes to reducing the risk of actually developing a blood clot. However, the blood thinners are used to treat a blood clot. So you would end up with a higher dose, and that dose helps the body to start breaking down that clot and preventing any more. There are times that surgery might be needed to remove the blood clot, but that would be something that you would definitely want to discuss with your clinician if that was the case for you. And now, if you had a blood clot, again, it's information about your health and your body that you've now established, because you are then at risk of developing blood clots in future pregnancies or in other conditions that make you at higher risk of having a blood clot, like having surgery, going on a long haul flight, and things like that. Whenever you learn something about your body, it's information that you can use for that next season in life, just like Serena Williams. I hope I haven't freaked you out. I hope you will go away from this video understanding that blood clots are common. It is a leading cause of maternal death worldwide. It can affect about 1 to 2 in 1,000 women all around the world, and that risk is higher than if you were not pregnant. That risk is even higher than if you were to take some hormonal contraceptives. Being as it is, it's really important that you understand your own risk factors for potentially having a blood clot. And if that were the case for you, knowing that you need to seek help early if you have any of those symptoms that I mentioned before. I'm also going to link down below some of my resources, especially a leaflet that you could read if you're worried that you might have a blood clot anywhere in the body, so that you can seek help and seek help with the right knowledge. So thank you so much for watching this video. Have you ever had a blood clot? How was it picked up? Are you in a country where the healthcare system doesn't necessarily risk assess you? How can you take charge of that? How can you make sure that you're having the right treatment? I want to hear from you down below. Use the comment section, like this video, subscribe to this channel, because Her Health Room is a space where I'm going to be discussing the physical, the mental, and the social recovery that's needed for you to thrive after delivery. Until next time.